This segment sponsored by Viking Psychiatry. Welcome to Mental Health Matters with Viking Psychiatry, and joining me today is Sean Goddard, who is the owner. And today we're going to talk about something very interesting called gene testing. Hello, good morning.
Good morning, so good to see you again.
You too. Okay, so gene testing, this is something that you have offered, but this is our first time talking about it. So give us an overview. What is gene testing?
Yeah, so to simplify it, it's a snapshot of what works for you, right? Far too often when it comes to the psychiatric field, I often tell people prescribing medications and providers in this industry, sometimes it's like throwing a dart at the dartboard, right? You have all these darts to choose from. You pick the one that looks the straightest, has the best feathers, right? And you throw it and you hope you hit the bullseye. But far too often we find that it's not hitting the bullseye. And then it's throwing another dart and another dart. And so what GeneSight allows us to be able to do is actually look inwards genetically and see a couple of different things, anywhere from the type of medication that might work best for you to also some gene expressions and how they can present in mental health.
And so how does this correlate with mental health? Because you're right, you wouldn't think, oh, well, let me get a gene test to see if I have mental health challenges. So does it really show what your challenges could be, or just get a better understanding of how to best diagnose those challenges?
Yeah, so I think all in all it comes together with the idea of what could best support you on your road, and also how there could be some opposite changes in response. So regretfully, there's no testing out there as far as genetic testing, blood work that can tell me you have depression, right? Or you have bipolar disorder. Although there is something in the works there, there's nothing that's readily available to say this is what you have and we can tell that based off of your genes. What this gene testing does is look at, for example, let's say you're struggling with depression. It will take every single medication that's available in the mental health field for depression and show us where your body lines up in usage of those. So do you absorb the medication correctly, break it down correctly? Are your levels going to be correct when you take the medication? Or are you more likely to have increased side effects? Or are you more likely to not respond to a medication? And so it gives us that in a snapshot. And for multiple, it shows us for depression, anxiety, ADHD, sleep, and some other options that are available there as well.
Yeah, that's really cool. It sounds like it's like indicators, right? That kind of just goes through and kind of marks to give you a better understanding of what's happening in the brain, or in the body rather. And I know that you have some really cool brain products that we talked about before that allows for you just to get a different synopsis of just where someone is to help them with treatment. And so if someone does need to get a gene test, is there an order that's involved with it?
Yeah, right now at this time, for a long time, insurance companies were very unfriendly when it comes to gene testing because, of course, like anything, when it first came out, it was very expensive. And so one of the requirements have been that you have to have a provider see you and sign off on that order to get it done because the insurance companies can request the record and check whether there's medical necessity is what they like to say, right? It doesn't matter about your necessity, your needs, on whether it's a medical necessity that they pay. And so while they have gotten more friendly and have reduced restrictions, it still does require being seen by a provider to sign off on that order.
Okay. And where does this fall in the mental health timeline, right? So if someone is feeling that they may be suffering from anxiety or depression and they may go to a physician to try out medications, do they do the gene testing first or do they do the chain of medications? Because I know that your services come after several medications do not work for them. So where does the gene testing fall in that?
Yeah, so I would like to say that it should fall at the very beginning, right? Because it sure would help to have that better understanding straight from the get-go, right? It's kind of like knowing who's going to win the Super Bowl beforehand with just a slight variance, right? You want to know, right? And so I would like to think that it would be at the very beginning and help reduce the burden and the load that people go through in treating mental health disorders. However, number one, not every office offers it, and some of the insurance companies companies do require that you have failed a couple of medications prior to them being willing to pay for it. So at Viking Psychiatry, one of the things that we offer is we offer the traditional gene testing, and there's 2 companies that we use, but we also use a third company that offers what would be considered a low for gene testing cash price. So if there's somebody that wants to get the gene testing before they go through trials, then they can get that if their insurance company wasn't going to cover it because they haven't failed medications to meet necessity.
Okay, so Viking can assist people in meeting that criteria?
Absolutely, and getting that done, we absolutely can. It's, we talk about the whole picture and looking at everybody individually and tailoring a plan to them. And gene testing really ties into creating that tailored plan, not only in regards to medication, but for example, there's a test that's part of that looks at something called MTHFR, which is a deficiency in folic acid, which there's a lot that goes along with it, and I could geek out for like 20 minutes about it with you. But in the end, it helps show whether you're making enough neurotransmitters in the first place. Do you have enough serotonin, norepinephrine, and dopamine, and glutamate? Let's not forget glutamate because it's so important. But it shows whether you have a deficiency, and if you have that deficiency, it's very easy to treat. And so it can make a significant impact and potentially reduce or eliminate the need for medications or the dosage of medications that you're on.
Oh, I love that. That makes a lot of sense. So see where you may have a deficiency, help that before going into more serious actions. Great.
Correct.
Awesome. Well, thank you so much, Sean.
Thank you so much. So good to see you again.
You too. And if you'd like more information about gene testing, this is something that Viking Psychiatry offers. We'll have their website listed below. Give them a call, and I'll see you after the break. This segment sponsored by Viking Psychiatry.
Have an idea for the show? Want to find out how you can be a guest? Contact us at livinglocal15@wayne.com.